So I found this article titled Australia's Universal Healthcare is Crumbling, Can It Be Saved? And I've skimmed through it already, and it's touched on a lot of really important issues in Australian medicine at the moment, including rural healthcare and the difficulties around that, the erosion of bulk billing, and it touches a little bit on the mental health and dental side of things as well. So I'm going to go through it bit by bit, and I'm just going to share some of my thoughts. From an office perched on the scalloped edge of the continent, Victoria Bradley jokes that she has the most beautiful doctor's practice in Australia. Outside her window, farmland rolls into rocky coastline, hemming a glass-like bay striped with turquoise and populated by showboating dolphins. Home to about 3,000 people, a few shops, two roundabouts and a tiny hospital, Streaky Bay is an idyllic beach town. For Dr. Bradley, though, it is anything but. The area's sole permanent doctor, she spent years essentially on call 24/7. So first things first, we're going to go to the health workforce locator, and we're going to find out exactly how Streaky Bay is categorized. Because I think a lot of people aren't aware of exactly how bad it is. And that's in a general sense as well. That's not just, I'm not talking about just Streaky Bay specifically. So if we look here, so this is saying it's very remote, MM7, and that's on a scale out of 8. Workforce shortage, yes to all. So yeah, it's definitely a very remote town. And what this means is well, as it says here, there's one doctor to service 3,000 people. And that leads to a lot of burnout. So a lot of people wonder, why don't we have more rural doctors? You know, what's attracting people to metropolitan areas? And this highlights one of the really important factors involved in that there's not enough resources. You know, it's a very intense lifestyle having to serve so many people as a doctor. And so while she's clearly very passionate about what she does, you can still get burnt out. So going into that, running the hospital and general practitioner clinic, life was a never-ending game of catch-up. She'd do rounds at the wards before, after, in between regular appointments. Even on good days, lunch breaks were often a pipe dream. On bad days, a hospital emergency would blow up her already punishing schedule. Burnt out, 2 years ago, she quit, and the thread holding together the remnants of the town's healthcare system snapped. Streaky Bay is at the forefront of a national crisis. Inadequate government funding is exacerbating a shortage of critical healthcare workers like Dr. Bradley. Wait times are ballooning, doctors are beginning to write their own rules on fees, and costs to patients are skyrocketing. A once revered universal healthcare system is crumbling at every level, sometimes barely getting by, on the sheer willpower of doctors and local communities. As a result, more and more Australians, regardless of where they live, are delaying or going without the care they need. Health has become a defining issue for voters ahead of the nation's election on the 3rd of May, with both of Australia's major parties promising billions of dollars in additional funding. But experts say the solutions being offered up are band-aid fixes, while what is needed are sweeping changes to the way the system is funded, reform for which there has so far been a lack of political will. Australians tell the BBC the country is at a crossroads and needs to decide if universal healthcare is worth saving. So, in Australia, we generally consider healthcare to be a basic human right, and so in that sense, it should be taxpayer funded. However, recent years has caused Medicare to not be sufficient, and so a lot of GPs are turning to are avoiding bulk billing. And we'll go into that a little bit more later, where we discuss GP services that are now not bulk billing. But some people blame Dr. Greed, and I don't think that's entirely fair, because I mean, if we look at this exact scenario, this doctor here, Dr. Victoria Bradley, she she's extremely overworked, and if Medicare is not supplementing that and not accounting for that fairly, then at that point she's how can I word this? She should be properly compensated for the work she does, and it should be reflective of the training she's done. But the thing is, how can you properly compensate someone who is always working? Because it's not like she can take time off. Being the only doctor, if she is not working at all times, that means there are gaps in healthcare for this town. And I think it's quite clear why that's a big problem. So let's talk a bit about how it affects patients, and this segment here goes into that quite well. Healthcare was the last thing on Renee Elliott's mind when she moved to Streaky Bay, until the 40-year-old found a cancerous lump in her breast in 2019, and another one 4 years later. So this really highlights the even even if you don't have extreme healthcare needs now, the system still needs to be set up in a way that it's accessible to everyone, because you never know when you might have a healthcare problem. So seeing a local GP was the least of her problems, with the expertise and treatment she needed only available in Adelaide, about 500 kilometres away. Mrs. Elliott has spent hundreds of hours and tens of thousands of dollars accessing life-saving care, all while raising 3 boys and running a business. Though she has since clawed back a chunk of the cost through government schemes, it made an already harrowing time that much more draining financially, emotionally, and physically. You're trying to get better, but having to juggle all that as well, it was very tricky. So, when people are trying to recover from a disease, we'd like that system to be as smooth as possible so they can focus on the recovery. But instead, a lot of the time, people are having to focus on very political and bureaucratic methods of staying afloat financially. And I think, in general, that's not what we want to happen. I think, we as Australians. And that's why taxpayer funded healthcare is so important. Because it's a system that, as I touched on earlier, that we all might need to access. And so I think having that covered means we're looking after the people that need to access it. Mrs. Elliott shouldn't have to be spending a lot of time and money to recover. Her focus should be on recovering, and as a society, we should be taking care of the financial um, and the side of things that are less physical, less direct. So when Australia's modern health system was born 4 decades ago, underpinned by a public insurance scheme called Medicare, it was supposed to guarantee affordable and accessible high-quality care to people like Mrs. Elliott as a basic right. So that's sort of what I was trying to get at before. We generally consider healthcare to be a universal right, and so as a universal right, we should make that more feasible. Health funding here is complex and shared between states and federal governments, but the scheme essentially meant Australians could present their bright green Medicare member card at a doctor's office or hospital, and Canberra would be sent a bill. It paid through rebates funded by taxes. Patients would either receive bulk billed, completely free care, mostly through the emerging public system, or heavily subsidised treatment through a private healthcare sector, offering more benefits and choice to those who wanted them. Medicare became a national treasure almost instantly. It was hoped this setup would combine the best part of the UK's National Health Service and the best of the United States system. Fast forward 40 years, and many in the industry say we're on track to end up with the worst of both. So that's what that's saying is that we're dealing with, longer wait times, and sort of care that's somewhat inaccessible, but also now there's a financial barrier to that care as well. And so that's what they're talking about, having the worst of both the United States system and the UK system. So I showed this graphic briefly before, and this is talking about the percentage of clinics in each local government area that are bulk billing. And as you can see from the graph, it's not a lot at all. So deep purple here means that there's no bulk billing clinic. And that's huge regions in Australia that are not bulk billing anymore. And then, it's very sparse regions that are doing where more than 50% of the clinics are bulk billing, which is not what we wanted. A decade ago, as this article said, you could go in, you could show your Medicare card, and your costs would be covered for that appointment. Now when you go in, you're paying $50 or more for a checkup, and it makes people not want to get checkups. And regular visits to your doctor, and we talked a bit about continuity of care in the last video, but that's not happening now because people don't want to be paying, an average of $40 every time they go to the doctors. And we can tie this in a little bit to reducing healthcare standards, where a lot of people feel like when they go to the doctor, nothing gets done. And that's sort of, what we're talking about back here. They go to the doctor, they give their complaints, and then the doctor just simply does not have time for them. And part of that is we need to be teaching doctors to be more passionate and empathetic. And I think a lot of the med schools are having a greater focus on that now. But also part of that is they simply don't have the time. Dr. Victoria Bradley probably doesn't have a lot of time to deeply connect with each patient like she would have. And I'm speculating here, obviously. But I think that logically follows that because she's so pressed for time, she could very easily miss things. And that wouldn't be her fault. That would be a failure of the system because this area is underserved. And Australia as a whole is being underserved. And so let's keep going. There is no denying that healthcare in Australia is still miles ahead of much of the world, particularly when it comes to emergency care, but the core of this crisis and key to this election is GP services or primary care, largely offered by private clinics. There has historically been little need for public ones, with most GPs choosing to accept Medicare rebates as full payment. That is increasingly uncommon though, with doctors saying those allowances haven't kept up with the true cost of delivering care. At the same time, staff shortages, which persist despite efforts to recruit from overseas, create a scarcity that only drives up prices further. According to government data, about 30% of patients now pay a gap fee for a regular doctor's appointment, on average $40 out of pocket. But experts suspect the true figure is higher, is skewed by seniors and children, who tend to visit doctors more often and still enjoy mostly bulk billed appointments. Plus, there's a growing cohort of patients not captured by statistics who simply don't go to the doctor because of escalating fees. So, all things that we touched on. Brisbane electrician Callum Bailey is one of them. Mum or my partner will pester and pester. I'm such a big, I'll just suffer in silence person because it's very expensive. And every dollar counts right now, the 25-year-old says. At my age, I probably should be in my prime looking for housing, but even grocery shopping is nuts. I just can't keep up. So this is talking about a bit of a wider systemic issue that's going on with the Australian economic system at the moment, but it does contribute to this, I guess, erosion of healthcare. This is a tale James Gillespie kept hearing. So his startup Clean Bill began asking the question, if the average Australian adult walked into a GP clinic, could they get a free standard appointment? This year they called almost all of the nation's estimated 7,000 GP clinics. Only a fifth of them would bulk bill a new adult patient. In the entire state of Tasmania, for example, they couldn't find a single one. Which, yeah, can be seen up here. See, in Tasmania, there is no bulk billing clinic. The results resonate with many Australians, he says. It really brought it home to them that, okay, it's not just us, this is happening nationwide, and that's just primary care. Public specialists are so rare and so overwhelmed, with wait times often far beyond safe levels, that most patients are funneled towards exorbitantly expensive private care. The same goes for a lot of non-emergency hospital treatments or dental work. There are currently no caps on how much private specialists, dentists or hospitals can charge, and neither private health insurance nor slim Medicare rebates reliably offer substantial relief. The BBC spoke to people across the country who say the increasing cost of healthcare had left them relying on charities for food, avoiding dental care for almost a decade, or emptying their retirement savings to fund treatment. Others are borrowing from their parents, taking out payday loans to buy medication, remortgaging their houses, or selling their possessions. So just continue on with the point. This is not the system we wanted set up. We wanted accessible, affordable healthcare, financed by the government. Kimberly Grimer regularly lies awake at night, calculating which of her 3 children, who like her all have chronic illnesses, can see their specialists. Her own overdue health checks and tests are barely an afterthought. And now we're really getting at the heart of it. Because of these problems, now we're getting people who have to prioritize which part of healthcare they're looking at. And so now under this system that we have going, people aren't getting the full range of services that they should be. They're decisions that you really don't want to have to make, the Aboriginal woman from New South Wales tells the BBC. When push comes to shove and you haven't got the money, you've got no other option, it's heartbreaking. Another woman tells the BBC that had she been able to afford timely appointments, her multiple sclerosis, a degenerative neurological disease, would have been identified and slowed quicker. I was so disabled by the time I got a diagnosis, she says. The people missing out tend to be the ones who need it the most, experts say. We have much more care in healthier, wealthier parts of Australia, so that's, we can go back to this and we can look at Sydney. And here we see that there's no real shortages in this area. We have much more care in healthier, wealthier parts of Australia than in poorer, sicker parts of Australia, Peter Braddon from the Grattan Institute think tank says. All of this creates a vicious cycle which feeds even more pressure back into an overwhelmed system while entrenching disadvantage and fueling distrust. So this is the graph. This is people who have delayed or skipped using a health service they needed in Australia. Every single one of those issues is more acute in the regions. Streaky Bay has long farewelled the concept of affordable healthcare, fighting instead to preserve access to any at all. It's why Dr. Bradley lasted only 3 months after quitting before guilt drove her back to the practice. There's a connection that goes beyond just being the GP. You are part of the community. I felt that I'd let them down, which is why I couldn't just let go. She came back to a far more sustainable 3-day week in the GP clinic, with Streaky Bay forced to wage a bidding war with other desperate regions for pricey fly-in, fly-out doctors to fill in the gaps. So this highlights, by not having enough staff, we're forced to rely on, locum doctors and fly-in, fly-out doctors, things like that, which are more expensive to fill the gaps. So it would be far more cost effective, both, on the government's behalf and then by extension taxpayers, if we were just staffing these regions well enough in the first place. And yes, a lot of people don't want to go to rural areas, but that's because of this. I think because they're underserved, it's become a cycle. Because they're underserved, people don't want to go there. Because people don't want to go there, they're underserved. So we need to find a way to break that cycle and really strongly incentivize new doctors to going to rural areas and building up in these areas. And I think the government needs to be listening to these rural doctors about what they need, because these are the people on the front lines here. These are the people that know exactly what the issues are and probably have a decent idea of how to solve them. And so in the previous video, we talked about My Medicare and how they've put $19.7 million dollars towards this My Medicare scheme. And I posed the question, maybe that money could have been better spent elsewhere. And, maybe that money could have gone towards this, towards maybe hiring another full-time doctor for Streaky Bay. But then, why Streaky Bay specifically? Well, that's because we're talking about it here. The problem is, if you look at any... So let's go here. And we can see how much of Australia is rural and by extension is underserved by healthcare needs. Shortage here. Shortages almost across the board here. I know I've just cherry picked 2 examples there, but you can go onto this yourself and you can have a look and see exactly what doctors are needed where, and you can see that this really is a national crisis. So even if they use that money towards hiring a new doctor for some of these regions, that doesn't solve the problem as a whole. And so I think we need to more highly prioritize this, because it is such a big issue and it has such an evasive solution with so many regions now needing this support. I think we need to get on it now. We need to start funding it as soon as possible. It's yet another line on the tab for a town that has already invested so much of its own money into propping up a healthcare system supposed to be funded by state and private investment. We don't want a gold service, but what we want is an equitable service, says Penny Williams, who helps run the community body which owns the GP practice. When the clinic was on the verge of closure, the town desperately rallied to buy it. When it was struggling again, the local council diverted funding from other areas to top up its coffers. And even still, most standard patients, unless they are seniors or children, fork out about $50 per appointment. It means locals are paying for their care 3 times over, Ms. Williams says, through their Medicare taxes, council rates, and then out-of-pocket gap fees. So a lot of people argue that people should pay for their own healthcare and that it should not be a sort of publicly funded system. And while they're entitled to that while they're entitled to that opinion, you can see here that not only are your taxes paying for it, but now you're paying for it as well. So the argument kind of falls flat there that they think that it shouldn't be taxpayer funded because it is, and it's being funded by people now as well. And with that said, I don't think we should abolish universal healthcare anyway. I think it's very important as a progressive society. But that's a whole other issue. No one would say this is the Australia we want, surely, Elizabeth Devaney from the Consumers Health Forum of Australia tells the BBC. Like many wealthy countries, the nation is struggling to cope with a growing population which is, on average, getting older and sicker. There's a small but increasing cohort which says it is time to let go of the notion of universal healthcare as we've known it. Many doctors, a handful of economists, and some conservative politicians have sought to redefine Medicare as a safety net for the nation's most vulnerable rather than a scheme for all. See, that's an interesting thought. Because while I don't agree with that, I can see that working. Health economist Yuting Zhang argues free healthcare and universal healthcare are different things. The taxes the government collects for Medicare are already nowhere near enough to support the system, she says, and the country either needs to have some tough conversations about how it will find additional funds, or accept reasonable fees for those who can afford them. There's always a trade-off. You have limited resources. You have to think about how to use them effectively and efficiently. The original promise of Medicare has been undermined by decades of neglect. The Australian Medical Association's Daniel McMullen says, and most Australians now accept the need to contribute to their own care. She says freezes to Medicare rebates, which were overseen by both parties between 2013 and 2017, meant that payments didn't even keep up with inflation. Medicare rebates were the last straw. Since then, many doctors have been dipping into their own pockets to help those in need. Both the Labor Party and the Liberal National Coalition accept there is a crisis, but blame each other for it. Opposition leader Peter Dutton says the government will invest $9 billion in health, including funds for extra subsidised mental health appointments and for regional universities training key workers. Health has become another victim of Labor's cost of living crisis. We know it has never been harder or more expensive to see a GP than it is right now, health spokesperson Anne Ruston told the BBC in a statement. On the other side, Albanese, whipping out his Medicare card almost daily, has sought to remind voters that Labor created the beloved system while pointing out the coalition's previously mixed support of the universal scheme and the spending cuts Dutton proposed as health minister a decade ago. At this election, this little card here, your Medicare card, is what's at stake, Albanese has said. His government has started fixing things already, he argues, and has pledged an extra $8.5 billion for training more GPs, putting additional public clinics, and subsidising more medicines. But the headline of their rescue package is an increase to Medicare rebates and bigger bonuses for doctors who bulk bill. Personally, I think that's probably a good start. Proposed by Labor, then matched by the coalition, the changes will make it possible for 9 out of 10 Australians to see GP for free, the parties claim. One Tasmanian doctor tells the BBC, "It is just a good election soundbite, so that is a concern. Don't believe everything you hear." He and many other clinicians say the extra money is still not good enough, particularly for the longer consults. More and more patients are seeking for complex issues. Labor has little patience for those criticisms, citing research which they claim shows their proposal will leave the bulk of doctors better off, and accusing them of wanting investment without strings attached. For many of the patients the BBC spoke to are sceptical either party's proposals will make a huge difference. There's far more they need to be doing, they say, rattling off a wish list. More work on training and retaining rural doctors, effective regulation of private fees, and more investment in the public specialist clinics, universal bulk billing of children for all medical and dental expenses, more funding for allied health and prevention. Experts like Mr. Breddon say, above all else, the way Medicare pays clinicians needs to be overhauled to keep healthcare access genuinely universal. That is, the government needs to stop paying doctors a set amount per appointment and give them a budget based on how large and sick the populations they serve are. That is something several recent reviews have said. And the longer governments wait to invest in these reforms, the more they're going to cost. The stars may be aligning now, It's time for these changes, and delaying them would be really dangerous, Mr. Redden says. In Streaky Bay, though, locals like Ms. Williams wonder if it's too late. Things are already dangerous here. Maybe that's the cynic in me, she says, shaking her head. The definition of universal is everyone gets the same, but we know that's not true already. So that's the end of the article, and it gave us a lot to think about. I think the important thing to take away here is, can it be saved? That's the question the article poses. I think this article presents a very hopeful view of that question. I think a lot is being done. I think it's being looked at. I think people are aware of how serious this issue is. And it looks like a lot of money is being committed to it. Whether or not that money is used in an appropriate and wise way is another thing. But it's a good start that people recognize it's a problem. We will see, especially after the election, what happens with this money that's being promised, where it goes, and I don't think this problem is going to be solved in a day. I don't think it's going to be solved over one election cycle. I think we need to be planting seeds now for solutions that will develop over time. Because, as I said, it's such a systemic issue. We really need to be creating holistic solutions from the ground up rather than just, the article mentioned, band-aid solutions. Rather than pouring money onto this fire, we need to be figuring out, where are these issues coming from, how can we fix them, and investing in those, even though it might not have immediate results. The problem is, with an election system, both populations and governments want immediate results, because that's what gets you elected. Being able to point and say, oh, look at what we've done to help rural healthcare, to help Medicare. So I think we need to be patient, and I think our solutions need to be more long-term rather than short-term. Because I mentioned about medical schools having such a great focus on rural healthcare. That's not going to have benefits for at least 4 years when these medical students who have been taught sort of a rural healthcare education graduate and are more likely to serve rural communities. That's 4 years away, and obviously I think this has been going on for years, so we might be starting to see benefits of that now. But you can see the point where actions taken now to solve these issues might not bear fruit for a while. And I think we need to keep that in mind, and I think we need to plan our solutions with that in mind. But I think that's all I have to say about that for now. And I think this will come up a lot, especially after the election. I think we can do a review maybe on this article, touch back on it, and compare it to a newer article when it comes out, and sort of see what's been done. But I think we really need to focus on our universal healthcare system. And I think that should be the forefront priority of what, and I don't want to talk too much about the election itself. I think people should, I'm definitely not qualified or wise enough to guide other people on who to elect. But I do think this should be one of your primary issues, regardless of where you fall on the spectrum on what you believe about universal healthcare. I think you do need to consider this very strongly in the coming election, over other political issues. Anyway, see you next time.